All right, hello everybody, and we're back at it here. This is Flagstaff Mountain. We're headed to the summit right now. Easy hike, but we're back out in nature, which is what I absolutely love. So today we're going to be teaching you specifically about Candida. I've been getting a lot of patients lately. They've seen some of my posts or some other videos about Candida on social media, so they're contacting me and saying, Dr. King, I want to know more about Candida. So we're going to film this video today. We're going to teach you why it's important to test for Candida. We're going to teach you some of the symptoms that Candida causes, and I'll just leave you with this. For thyroid patients, Candida mimics many thyroid symptoms. So we're going to talk about that today as soon as I can find my way to the summit, because there's a lot of trails here. Okay, note to self. It may be a good idea to look at the maps before you start hiking some of these mountains. I didn't do that today. I'm a bit lost. But it's kind of like life. Sometimes you take turns and you end up in the wrong destination. So well, hello everybody, this is Dr. Corey King from AskDrKing.com. We are at the top of Flagstaff Mountain right here in Boulder, Colorado. This is an easier mountain to hike up, and this is actually a really neat amphitheater that was built back in the 1930s. Last year when we came here in December, I hiked up this in the snow, and I didn't even realize it was the same mountain today until I got to the summit and went, oh my gosh, there's an amphitheater. So now I know where I'm at after getting lost, so you saw that part. So it kind of ties into this video, because whether you're hiking in the mountains or you are looking for answers to your health condition, you need to have a map to follow. And when it comes to looking at health conditions, those maps are based off of data and lab results. So you want to make sure that your doctors are getting all the right pieces to your health puzzle. And I say that to every patient when I talk to them, because if we don't have all the pieces, then how in the world can we complete the picture? If you have a complete picture, then you can come up with a game plan of what you need to do. So today we're not talking genetics like we have been in a lot of our videos. We're talking about a fungus. And this fungus is a fungus that grows in a lot of patients' bodies, and I'm finding it in more and more thyroid patients, and that fungus is called Candida. Now, Candida, it likes to take hold in the gastrointestinal tract, and it does so due to an environment that breeds this fungus to grow. And what do I mean by that? If we all think back about our life, I'm sure most of us have binged out on sugars. We've binged out on carbohydrates. If you've been an athlete, and I know as myself growing up, I was always told to carb load before a big endurance event. And carbs, if we don't burn those carbs off, they turn to sugars. So sugary drinks, sodas. Growing up in the South, there was a tiny little gas station at the end of the road that I grew up on, and it was about 1.5 miles, I think, down to that store. And as a kid, we used to walk down there, or we would ride our bikes down there with our friends, and we would go and buy junk. And we would buy Mountain Dew, oh my gosh, and Mellow Yellow. Thank you, Days of Thunder, for the Mellow Yellow advertising, because I started drinking Mellow Yellow because of the movie Days of Thunder. So if we think about our life, all of us have consumed in abundance sugars. And even our vegetarians, our vegans, if they're not focusing on low starch vegetables, they can be consuming too many carbohydrates that turn to sugars. Now, why is this important? Well, sugars are going to create this environment for this fungus to begin growing. And earlier this week, I talked to the daughter of a father that is becoming a patient, and she was telling me that he has all this toenail fungus. Well, my goodness, if you've got toenail fungus, that's the fungus from the inside of your body working its way out. Extreme scenario. Some people start to get these rashes, unexplained rashes, such as eczema. Anything that's inside of the body that's creating inflammation is going to try to work its way out. And when a patient tells me that they have these unexplained rashes, or I had a patient this week, these boils that actually burst, we want to think, what in the world is creating that environment inside of the body for those toxins to want to come out? And one thing that I'm finding a lot of in patients is Candida overgrowth. Now, check out the symptoms of Candida: brain fog, fatigue, digestive issues, decrease in libido, muscle and joint pains, sleep disruption. Do those symptoms sound similar to thyroid symptoms? A lot of the symptoms of Candida are very similar to the symptoms in a thyroid patient. And a lot of times thyroid patients will have perfect thyroid markers, but they're still having brain fog, or they're still having depression, they're still having fatigue, they're not sleeping very well. And they're going, but my doctor keeps telling me my lab tests are normal. I look at them, I agree. Then I go, we've got to dig deeper. We've got to get more answers to figure out what in the world's going on. We've got to have that map. So with Candida, high sugary foods, high carbohydrate foods are going to drive this. What are some symptoms of Candida? Well, we just went over those. So anytime a patient tells me brain fog, fatigue, muscle and joint pains, we can even start to have neurological disorders because Candida releases a neurotoxin. And for those that don't know what a neurotoxin is a toxin that destroys the nervous system. So it affects the brain, it affects the neurons of the brain, it affects the nerves. So if somebody's having peripheral neuropathy, it would behoove us to look for these neurotoxins that may be being released due to a fungus. So when a patient starts to share these symptoms with me, I always like to test, because we'll never know for certain if we do not do any testing. Now with testing can be a bummer, because for most of the testing out there, like these specialized tests, we must pay out of pocket for it. The typical medical model, the insurance model, it just doesn't play this game of digging deeper, looking for your answers. To me, I think it's a game for them, because it's like we pay so much money for insurance, at least my wife and I do. Why can we not use this for tests that are going to give us answers to explain our symptoms? Now, besides testing for Candida, we're also going to get your levels of your good and your bad bacteria. Because if you have a fungus that's disrupting your gastrointestinal tract, it's going to affect your bacterial levels. If you didn't have enough good bacteria in your system to begin with, maybe this is why the fungus took hold. If you don't have enough good bacteria in your system, you're not going to be able to absorb your vitamins and your minerals. You're going to have constipation. You're going to have GI issues. You could have chronic diarrhea. You could have bouts of IBS if you don't have enough good bacteria in your system. So we're going to test for that. We're going to test all these different levels of bacteria. Besides testing for the Candida and the bacteria, we're going to start to look at antioxidants. Now, if you've been following along, one of my last videos on the top of Sugarloaf Mountain, which was a rad mountain, by the way, if you haven't watched that video, that is a video where I discuss the genetic genes that affect detoxification. So essentially, it's the genes that affect detoxification. Genetic genes? Anywho. All right. Early, high altitude, we blame it on that. In that video, we were talking about glutathione and N-acetylcysteine. Now, we're going to test for those in this test as well. Those are extremely important because they help to bind toxins. So if you have Candida and we start to kill it off, Candida typically releases more neurotoxins as the fungus is being killed off. Now what that means is you can have horrible, horrible die-off. We will use things such as NAC and glutathione to help counteract that die-off. We're also going to measure your B vitamin levels. We'll measure vitamin C. We're going to look at biotin because, hey, thyroid patients, hair, skin, and nails, right? So we'll look at your biotin levels. We're also going to evaluate your mitochondria. Now your mitochondria from that last genetic video, those are the little workers that are producing energy. So we're going to evaluate those levels as well. So for $169, we get all of this information to start to tell us what in the world is going on with your body. Remember, genetics, that's the beginning. This is the intermediate test that I referred to on that detoxification video. What do you do if you have Candida? Well, you got to kill the sucker off. Now, I have a protocol for this. Now, most Candida protocols are very, very similar. I tweak and I change and I modify them a little bit just to fit my philosophical thoughts and processes when it comes to getting rid of infections. What it typically will start with is 1 week of you being vegan. And you being vegan means we're cutting out meat, we're cutting out nuts, we're eating low-starch foods. I highly recommend downloading from the ultimatecandidadiet.com all of their PDFs. This will teach you in more detail about Candida. We bought the program, it's 37 bucks. We bought the program because we specifically wanted more recipes as we were killing off our Candida. When we tested Natasha's Candida levels, they were through the roof. And if you're a patient of mine, and we may have talked about this, they were higher than any patient I've ever tested. We wanted more recipes to help us through that 8 to 12 week process that she went through to help kill off the Candida. So the ultimatecandidadiet.com, I highly recommend it. My protocol, I specifically tell you what to take because they give you a laundry list of herbs that you can take. I narrow it down for you and say, look, this is what I recommend. This is what we've done for ourselves. What I'm telling you or teaching you isn't anything that we have not done. Okay, Natasha and I have both been through this. So we know the pain, we know the die-off of killing the Candida. So it starts with essentially going vegan for the first week. We're using a lot of bone broth, we're consuming low starch veggies, and then we start to take an anti-fungal the second week. The anti-fungal that I like to use is also an anti-parasitic, and it is an antibacterial. A lot of times with Candida, you're going to find parasites living there as well, or we can find an overabundance of bad bacteria. So we want to clear all that out, and if we can do it all with just one product, let's do that. The product I recommend is called GI Synergy. I would not buy it on Amazon because you are going to pay 2 to 3 times the retail price. Now, you add in the antifungal, but then we also start to add in some binding agents. And what I mean by that is the neurotoxin acetaldehyde, when it starts to get released from the fungus, when you're killing that fungus off, you can have major die-off effects. And what could those be? For myself, they were joint pains, major joint pains in my fingers, especially when I woke up in the morning. For Natasha, they were migraine headaches, and she felt like she was fighting the flu. Everybody's die-off reactions can be different. As we're killing off the fungus, we're also wanting to patch up the gut lining. So that can take some time. For some patients, patching up the gut lining can take 4 weeks. For some patients, it can take upwards of 12 to 16 weeks. It also depends on what other health issues you have, what other toxins are in your body. But specifically today, we're just talking about Candida. So let's kind of recap here. Candida can mimic a lot of symptoms that other conditions cause, especially thyroid conditions. Some of the major symptoms are brain fog, muscle weakness and fatigue, joint pain, gastrointestinal disorders, and we've seen it start to cause neurological disorders because it releases a neurotoxin that destroys the neurons and it can destroy the nervous system. So those are the nerves. So it could cause things such as tingling and numbness. If you're having any of those symptoms, it would behoove you to test to make sure that you either have the Candida so you can start to kill it off, or you don't have it. So that's a piece of the puzzle that you've already checked off. You don't have to worry about that anymore if you do not have it. If you have it, you need to dive into a Candida protocol. I recommend downloading the ultimatecandidadiet.com. I really should get paid for marketing for them because I tell my patients about them all the time. We bought their program. I think it's great information to teach you a little bit more about Candida. My Candida protocol, I specifically tell you what you need to take how to take it. That protocol can last anywhere from 4 to 12 weeks, and that all depends on how bad your Candida levels are. All right, that's going to wrap up today's educational video. Again, this is Dr. Corey King. If you have any questions, feel free to email me at drking@askdrking.com, and make sure to catch some of our other videos where we're teaching you all about how to get your body healthy and kick butt so you can get up here and climb some mountains with me. All right, we'll see you on the next video.